A few years ago, I had a conversation with a patient that has stayed with me ever since. He was 78, calm, proud, and very consistent with his routine. When I asked about his activity level, he smiled and said, "Doctor, I walk every single day. Rain or shine, I never miss it." And I believed him. He was doing more than many others his age. But when I reviewed his mobility evaluation and movement tests, something didn't match what he expected to hear. I explained to him gently that walking is valuable, but it doesn't fully protect the systems responsible for strength and stability later in life. He looked surprised, so I broke it down. Walking mostly repeats the same forward motion pattern. It improves circulation and endurance, but it doesn't challenge deeper stabilizing muscles around the hips, spine, and joints. Stabilizers are the muscles that keep you balanced when you stumble, turn, or react suddenly. Without activating them regularly, they weaken quietly, even in people who remain active. He paused for a moment and asked the question I hear constantly: "So, what should I be doing instead?" That conversation led us through several simple home exercises designed to activate muscle fibers walking rarely touches. Muscle fibers are the tiny units responsible for producing strength and supporting joints. Within weeks of integrating these movements, his functional balance scores improved and his confidence in daily movement noticeably increased. That moment reshaped how I communicate with patients about mobility after 75. In this video, we will reveal and rank 6 home exercises from least impactful to most important, and stay with me because number 2 has repeatedly demonstrated meaningful influence on stability markers in older adults. Supporting sources are listed in the description for those interested. Before we dive in, I'd love to ask you something. How old are you today, and where are you watching from? I read your comments and genuinely appreciate hearing your experiences. Now, let's begin with number 6 and a movement many overlook that prepares the body for safer daily motion. Number 6. Seated marching. This one might sound simple, and that is exactly the point. Seated marching is the gateway exercise that orthopedic surgeons recommend as a foundation before anything else because it targets the hip flexors, which are the muscles that run along the front of your hip and connect your thigh bone to your lower spine. After 75, these muscles shorten and weaken dramatically, especially in people who spend a lot of time sitting. When your hip flexors are weak, your body compensates by shifting more load onto your lower back, and that is one of the biggest reasons older adults develop chronic lumbar pain that seems to come out of nowhere. A study from the Journal of Geriatric Physical Therapy found that adults over 70 who performed seated marching for just 10 minutes a day, 5 days a week, showed a 23% improvement in hip flexion strength within 8 weeks. That is a significant change from such a low-impact movement. To do this exercise properly, sit in a sturdy chair with your feet flat on the floor and your back straight against the backrest. Slowly lift your right knee as high as you comfortably can. Hold it at the top for 2 full seconds. Then lower it back down with control. Then do the same with your left knee. The key here is not speed. You are not trying to march quickly. You want each lift to be deliberate and controlled, really squeezing the muscles at the front of your hip as you raise the knee. Aim for 15 to 20 lifts on each side and do 2 to 3 rounds. If you want to increase the challenge over time, you can place a light ankle weight on each leg, starting with just 1 pound and working your way up. The beauty of this exercise is that you can do it while watching television, sitting at your kitchen table, or even waiting in a doctor's office. It requires no equipment, puts zero stress on your joints, and begins rebuilding the hip strength that walking completely ignores. Orthopedic specialists say this is the exercise that gets people ready for everything else on this list, and skipping it is one of the most common mistakes they see. Now let us move to something that targets an area most people never even think about. But before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Number 5, standing calf raises. Your calves might be the most underestimated muscles in your entire body, especially when it comes to preventing falls after 75. Here is why orthopedic surgeons are so insistent about this one. Every single time you take a step, your calf muscles act as the final stabilizer that keeps you from tipping forward. When you stumble or catch your foot on a rug or a curb, it is your calves that fire to pull you back into an upright position before you fall. A landmark study from the American Journal of Physical Medicine and Rehabilitation tested calf strength in adults between 75 and 85 and found that those with weak calves were 3.4 times more likely to experience a fall, resulting in a fracture compared to those with strong calves. That number is enormous when you consider how devastating a hip or wrist fracture can be at that age. To perform a standing calf raise at home, stand behind a sturdy chair and lightly hold the back of it for balance. Your feet should be about hip width apart. Slowly rise up onto the balls of your feet, lifting your heels as high off the ground as you can. Hold that top position for a full 3 seconds, then lower yourself back down slowly over another 3 seconds. That slow lowering phase is crucial because it works the muscle in what scientists call the eccentric phase, which is where the real strengthening happens. You want to do 12 to 15 repetitions per set and aim for 3 sets total. If you feel steady enough after a few weeks, try doing the raises on one foot at a time while still holding the chair. That single leg version doubles the workload on each calf and dramatically accelerates the strength gains. Do these every single day if you can. Your calves recover quickly and respond incredibly well to daily training, and within just a few weeks you will notice that your ankles feel more stable, your walking feels more secure, and your confidence on uneven surfaces improves significantly. The next exercise targets something that affects nearly every person over 75, whether they realize it or not. Number 4. Wall push-ups. Most people over 75 have not done a push-up in decades, and many assume that push-ups are simply not for them anymore. But orthopedic surgeons will tell you that upper body strength is not optional as you age, it is critical. Here is the reality that does not get talked about enough. When an older adult falls, the ability to catch yourself with your arms and absorb the impact is often the difference between a bruise and a broken hip or a fractured wrist. A study published in the journal Osteoporosis International found that adults over 70 with stronger upper body muscles had 41% fewer fractures from falls compared to those with weak upper bodies, even when the falls themselves were similar in severity. That means your arms, chest, and shoulders are literally acting as a protective shield during a fall. The wall push-up gives you all the benefits of a traditional push-up without putting any dangerous pressure on your wrists or shoulders. Stand about 2 feet away from a solid wall and place your palms flat against it at shoulder height, slightly wider than shoulder width apart. Keeping your body in a straight line from your head to your heels, slowly bend your elbows and lean your chest toward the wall. Go as far as you comfortably can, then push yourself back to the starting position. The movement should be smooth and controlled, taking about 3 seconds to lean in and 3 seconds to push back out. Start with 10 repetitions and work your way up to 3 sets of 15. As you get stronger, you can increase the difficulty by stepping your feet further away from the wall, which puts more of your body weight into the exercise. Some people eventually progress to doing push-ups against a kitchen counter, which is a steeper angle and significantly more challenging. The important thing is that you are training your chest, shoulders, and triceps in a way that directly translates to real-world protection. Every time you push a door open, lift a bag of groceries, or brace yourself against something, you are using the exact muscles that wall push-ups strengthen. Orthopedic surgeons say this is one of the most neglected exercises in the over 75 population, and adding it to your routine could be one of the smartest decisions you make. What comes next is the exercise that addresses the silent threat lurking in almost every aging body. Number 3, chair squats. If there is one movement pattern that predicts whether an older adult will remain independent or end up needing full-time assistance, orthopedic surgeons say it is the ability to sit down and stand back up without help. That might sound basic, but a groundbreaking study published in the European Journal of Preventive Cardiology found that adults over 70 who could not rise from a seated position without using their hands had a 5 to 6 times higher risk of mortality over the following 6 years compared to those who could. That is not a small difference. That is a massive life or death gap, and it all comes down to the strength of your quadriceps, glutes, and core working together in one functional movement. The chair squat is the single best exercise to train this exact pattern. Start by standing in front of a sturdy chair with your feet shoulder width apart. Slowly lower yourself down toward the seat of the chair by bending your knees and pushing your hips back, as if you were about to sit down. The goal is to control the descent the entire way down rather than just dropping into the chair. Lightly touch the seat with your backside, pause for 1 second, and then push through your heels to stand back up. Keep your chest lifted and your weight in your heels throughout the entire movement. If standing back up without using your hands is too difficult right now, that is completely fine. Place your hands on the armrests or on your thighs and use them to assist you. Over time, use your hands less and less until your legs are doing all the work. Aim for 8 to 12 repetitions and 2 to 3 sets. The reason this exercise is ranked so high on this list is because it mimics the exact movements you perform dozens of times every single day. Getting out of bed, standing up from the toilet, rising from the dinner table, getting out of a car. Every one of those actions is a squat, and when your legs are not strong enough to handle them, your independence starts slipping away. Orthopedic surgeons see this pattern constantly, and they say that the patients who do chair squats regularly are the ones who stay out of assisted living the longest. The strength you build with this one exercise carries over into literally every part of your day, and losing it is often the first domino that leads to a cascade of dependence. Now we're getting into the exercises that orthopedic specialists consider absolutely non-negotiable. Number 2. Single leg balance holds. Balance is not just something you either have or you do not. It is a skill that is controlled by a specific system in your body, and that system deteriorates faster than almost anything else after 75. Your ability to balance depends on 3 things working together: your vision, the vestibular system in your inner ear, and something called proprioception, which is your body's ability to sense where it is in space without looking. After 75, all 3 of these systems decline significantly, and the only way to slow that decline is to actively challenge your balance on a regular basis. A major clinical trial published in the BMJ in 2022 followed over 3,000 adults aged 70 and older and found that those who practiced balance exercises at least 3 times per week reduced their risk of falls by 36% over 2 years. That is more effective than any medication currently available for fall prevention. The single leg balance hold is the simplest and most effective way to train this system at home. Stand next to a counter or a sturdy piece of furniture and lightly rest your fingertips on it for safety. Lift one foot off the ground by bending your knees slightly and try to hold that position for 30 seconds. Keep your eyes focused on a single point straight ahead of you, because fixing your gaze dramatically improves your balance during the hold. After 30 seconds, switch to the other leg. Do 3 holds on each side and practice this every single day without exception. As your balance improves over the first few weeks, start reducing how much you rely on the counter. Go from full hand support to just fingertips, then to hovering your hand above the surface without touching it, and eventually try doing it with no support at all. Once you can hold for 30 seconds on each leg without any support, you can increase the challenge even further by closing your eyes during the hold. This removes your visual input and forces your inner ear and proprioceptive system to work even harder, which builds balance at an accelerated rate. Orthopedic surgeons rank this exercise so highly because the data is crystal clear. The number 1 cause of catastrophic injury in adults over 75 is falling, and the number 1 way to prevent falling is to train your balance. It takes less than 5 minutes a day, it requires no equipment, and the science says it works better than anything else available. There is simply no reason not to do it. The people who commit to this one exercise notice changes faster than almost anything else, and many report feeling more confident on their feet within the very first week. And now the exercise that researchers and orthopedic surgeons alike call the most important movement any person over 75 can possibly do. Number 1. Hip hinge with support. This is the one. This is the exercise that Harvard Medical School researchers identified as the single most protective movement for preventing hip fractures in older adults, and it is the one that almost nobody over 75 is doing. The hip hinge is a movement where you bend forward at the hips while keeping your spine completely straight, then return to an upright position by squeezing your glutes and hamstrings. It is the foundation of every bending and lifting motion you perform in daily life, from picking something up off the floor to bending over to tie your shoes to reaching into a low cabinet. And here is the critical part that makes this the number 1 exercise on this list. A study published in the Journal of Bone and Mineral Research followed over 8,000 adults aged 75 and older for a period of 5 years and found that those with strong glutes and hamstrings, the exact muscles trained by the hip hinge, had a 54% lower risk of hip fracture compared to those with weak posterior chain muscles. 54%. To put that in perspective, that is a greater reduction in fracture risk than what is achieved by most osteoporosis medications currently on the market. The reason the hip hinge is so protective comes down to biomechanics. When your glutes and hamstrings are strong, they act as shock absorbers that protect your hip joint during any impact, including a fall. They also keep your pelvis properly aligned, which reduces the compressive forces on your lumbar spine and prevents the forward-leaning posture that makes older adults so vulnerable to losing their balance in the first place. To perform a supported hip hinge at home, stand about a foot behind a kitchen counter or a sturdy table and rest your fingertips lightly on the surface. Your feet should be hip-width apart with a very slight bend in your knees. Now, keeping your back completely flat and your chin slightly tucked, slowly push your hips straight back behind you as if you were trying to close a car door with your backside. You should feel a deep stretch in the back of your thighs as you hinge forward. Go down only as far as you can while maintaining a perfectly flat back, which for most people will be about a 45-degree forward lean. Pause at the bottom for 2 seconds, then squeeze your glutes hard and drive your hips forward to return to standing. That squeeze at the top is the most important part of the entire exercise because it is what activates and strengthens the glute muscles that protect your hips. Start with 8 repetitions and 2 sets and gradually work your way up to 12 repetitions and 3 sets over the course of several weeks. The tempo matters enormously here. Take 3 seconds to hinge down, hold for 2 seconds at the bottom, and take 2 seconds to drive back up. That controlled pace ensures that your muscles are under tension long enough to actually get stronger, rather than just going through the motions. As you become more confident with the movement, you can reduce your reliance on the counter support and eventually perform the hinge while holding a light object like a water bottle or a small book in front of your chest, which adds resistance and increases the strengthening effect. Orthopedic surgeons emphasize that the hip hinge is uniquely powerful because it addresses the 3 biggest threats to independence after 75 all at once. It strengthens the muscles that prevent hip fractures, it reinforces the spinal alignment that prevents chronic back pain, and it trains the exact bending pattern that people use every single day but almost never practice with proper form. When your body knows how to hinge correctly, you stop rounding your lower back every time you bend over, and that alone can eliminate years of accumulated spinal stress. The researchers at Harvard were so struck by the data that they included the hip hinge in their updated guidelines for fall prevention in older adults, calling it the single highest priority exercise for anyone over 75 who wants to maintain their mobility and avoid a life-changing fracture. If you do only one exercise from this entire list, make it this one. Your hips, your spine, and your future self will thank you for it. Many orthopedic surgeons now start their older patients on this movement before anything else, because once the hip hinge is solid, every other exercise on this list becomes safer, more effective, and easier to perform correctly. So there you have it, 6 exercises that orthopedic surgeons are now telling every patient over 75 they absolutely need to be doing at home. Walking is still great, and you should keep doing it. But if walking is the only thing you are doing, you are leaving your body vulnerable in ways that could cost you your independence, your mobility, or worse. These 6 exercises take less than 20 minutes a day, they require no equipment, and the science behind every single one of them is rock solid. Start with the ones that feel most manageable, build consistency, and over time work your way through the entire list. Your body at 75, 80, 85, and beyond is far more capable than most people give it credit for. It just needs the right kind of challenge. The research is clear, the exercises are simple, and the results speak for themselves. All you have to do is start. If this video helped you, or if you think it could help someone you care about, please subscribe to the channel so you never miss content like this. We are here to help you move better, feel stronger, and live with more confidence every single day. We will see you in the next one. Thank you so much for watching.